Hey, what up, hello, and how's everyone doing today? Alex Kapitko here, catching you guys up briefly on the Tonic Accord. So let's be honest, 2020's been crazy. Politics are crazy. The world's crazy. I'm probably going crazy. And so why not just add a little bit of extra crazy to it? So on Sunday, the CDC released a report that has kind of gained a lot of controversy, and it's kind of just helped fuel the partisan divide we have on coronavirus. And so basically, the CDC released a report that said that close to 94% of Americans who died from COVID-19 had some other type of health condition or contributing cause. So, in other words, this is basically saying that the CDC found that most people who died from the virus had other health conditions that led to their death. But these people also tested positive for COVID when they were either hospitalized, dying, or after the autopsy. So, this information reportedly came from data from the CDC relating to coronavirus deaths, and it spans all the way from February through August 22nd. So that's a lot of information over a long period of time. But from this data, the CDC concluded that only 6% of COVID deaths were unrelated to other health issues. And so this is this is complicated because I remember seeing this report come out yesterday, and many people were quick to post it on social media. You know, the main people who were quick to post this story were the ones who for months were saying that we're overreacting to the virus and that it isn't as serious as we may think. And these are also likely the people who, posted that Plandemic documentary, which was a conspiracy and a bunch of falsehoods talking about how the virus was basically created in order to not only control global populations, but incentivize profits from a vaccine. And so pretty much the same people who are now applauding this current CDC study are also the ones who have kind of wanted this virus to be somewhat fake the whole time. These are the people that, are also probably not going to social distance. They're not going to want to wear a mask, and they're going to think Trump handled the virus well. And first, I do think that it's important to note that it does seem like this virus attacks weaknesses or vulnerabilities, or people who are more compromised in terms of their overall health. And this is probably why death rates are higher in the United States, and also higher amongst older people, obese people, people with pre-existing conditions, like diabetes, those who smoke, or those with health issues such as, heart disease or hypertension. Your body's already weak, and this virus seems to kind of compound on top of that. But now this assessment that, people are taking away from 94% of people who died from COVID had another existing condition. It's a bit misleading, honestly, because the virus is still killing these people at the end of the day. Or at least say you had hypertension and didn't get affected by COVID and you're in your 50s or 60s. It's a lot more likely that the hypertension's treatable or you can manage it. But now all of a sudden, if you're in a risky age category and you have an underlying condition, COVID's kind of like the icing on the cake. And I think that's what we're seeing here is that COVID's just kind of the finalizing factor, or it's a secondary factor in killing these people. And so it's very disingenuous to say that COVID didn't kill these people. These other viruses did, or these other health effects did. Because at the end of the day, it's kind of the combination of the two. And that's the danger of COVID, is the fact that it's kind of expediting already existing health problems inside of the United States. So it's really misleading to say that, only 6%, according to the CDC, actually died from COVID. That's just incorrect. And so there is also a great article out of ABC News 10, and it discusses that maybe these numbers are being described the wrong way more than anything. So let's look into that. I'm gonna take a few little excerpts from this article. But basically, the article's talking about how the numbers have been described the wrong way because people, as always, in the political landscape we're in here in the US, people are going to cherry pick their data. And that kind of seems what's happened here. So the article says, in quotes, the Centers for Disease Control said 6% of COVID-19 deaths were from COVID alone. But the claim that the virus killed only 9,000 Americans is incorrect. Most deaths from the coronavirus had causes in addition to COVID, not instead of it, end quotes. So basically this just means that 94% of Americans who died of the virus had other conditions, but it just amplified the effects, COVID, once it hit them. This doesn't mean that COVID was just dormant in their systems and had no impact on their deaths. And so I think the real question that we need to be asking ourselves here is, did COVID accelerate the demise of these people? And if it did, this is worrying because even if most Americans, especially young Americans, can spread this asymptomatically, it's still concerning that there are people who currently are managing their health problems who could still get it and die. And so this means to me that COVID is still a threat. And the fact that people are just kind of spreading this cherry-picked story is not good for public safety or for public health. And Forbes has another great example, and I'm going to read it. So Forbes says, and it's kind of an interesting example, but bear with me here. So they say a person gets COVID-19 coronavirus infection, which eventually progresses to pneumonia, respiratory distress, organ failure, and death. Then there's a decent chance doctors will indicate more than one of these conditions as a cause of death, right? After all, and now this is Forbes' example here, so in quotes, after all, when you go to the grocery store, come back with a bunch of food and 5,000 rolls of toilet paper, and are asked, where have you been and what have you been doing? You don't just say, I got into the car. Instead, you tell the whole story. I bought banana bread, I bought toilet paper, I purchased, I drove there, I waited in line. And this is a reminder that the virus is not just some simple thing in which it infects you and kills you. It's going to trigger a chain of events that can eventually lead to a person's life being ended. And so again, that's another problem. And it's something that I don't think we're talking about enough. And I think it's easy to say, well, most Americans who died were sick. But that's not the full picture, and that's not the full story. And obviously, I'm no expert, I'm no doctor, I'm no medical expert. But to me, it's very clear that just because the virus isn't directly killing you, does not mean that it's not a leading factor in your death. And now the second reason I'm kind of talking about this story too is because of something Drew and I talked about, I guess 2 weeks ago now, which is QAnon and conspiracies in the Trump administration. And so there was a QAnon account that was called MelQ, and they were one of the big arbitrators of this discussion about how coronavirus actually hasn't killed that many of Americans. And this account basically said that, actually only about 9,000 Americans have died from coronavirus, so it's not important. And then this was retweeted by Donald Trump Jr. People in the Trump administration liked it. Trump has mentioned it, and then it was taken down. But by the time it was taken down, I think the damage was already done. And that's the second part of this story, is that the Trump administration has kind of tried to do whatever they can to perpetuate this story already. And so now they're just getting helped by these kind of half-assed CDC reports or the media coverage of these CDC reports. And that's the problem I have here, is that I think actual information is falling out of favor in exchange for cherry-picked stories, and the media on both sides, honestly, is doing this. So, yeah, this is just a quick story. I didn't really want to spend a whole lot of time on it today, but please just do your research. Make sure that you're getting the full picture. Make sure you're fact-checking, and make sure you're actually reading the articles that people post on social media. Because coronavirus, it's true that if you're healthy and or young, it's likely that it's not going to affect you. But it's more complicated than that. And as a country, we have lost over 180,000 Americans, or close to that at this point. And that's still serious, even whether it's a contributing factor to their death or the leading factor to their death. It's still a death, and it's still not good for their families or our country. So with that, we'll be back, and take care, guys. And yeah, do your research. Bye. Have a good night.